So moving around to the back of the forearm, we come across the extensors of the wrist and digits, or the extrinsic extensors of the wrist and digits. As with the flexors of the wrists and digits, the extensors are divided up into two layers. The superficial layer being those muscles that arise either in whole or in part from the common extensor origin or the common extensor tendon, and a poneurotic structure that attaches to the lateral epicondyle, the lateral collateral ligament of the elbow, and the adjacent fascia. These muscles include extensor carpi ulnaris, extensor digiti minimi, extensor digitorum, extensor carpi radialis longus and brevis, and also includes supinator and brachioradialis. Now, although supinator and brachioradialis are not part of the finger and wrist extensors, they're often grouped in with these muscles because they share a common compartment and a common nerve supply. So starting off with the first muscle, we've got extensor carpi ulnaris. We can see extensor carpi ulnaris here, this little chunky muscle running down the medial aspect of the medial side of the posterior aspect of the forearm. It has two heads. It has the humeral head that comes from the common extensor origin, and then the ulnar head that mirrors what flexor carpi ulnaris does, arising from the posterior border of the upper 2/3 of the ulna. Forms a long tendon, and the tendon passes underneath the extensor retinaculum before inserting onto the base of the fifth metacarpal. So it mirrors what flexor carpi ulnaris does. Its action is as an extensor of the wrist and an ulnar deviator of the wrist. When it works in conjunction with flexor carpi ulnaris, the two muscles cancel out each other's flexor extensor moment, and you end up with pure ulnar deviation. The nerve supply to this muscle is the posterior interosseous nerve, C7 and T8, and occasionally takes a branch from the ulnar nerve too. Next to ulnaris, we can see extensor digitorum. Extensor digitorum is again a fairly thin little muscle arising from the common extensor origin, runs down the posterior aspect of the forearm under the extensor retinaculum before dividing up into its terminal branches, into its four terminal tendons. Each of the four tendons passes on to each of the four medial digits. And as it passes towards its four digits, it produces a structure known as the the dorsal digital expansion. Its nerve supply again is via the posterior interosseous nerve, and here we can see the dorsal digital expansion. So in this lower diagram over here, we can see the tendon of extensor digitorum. At the level of the metacarpal heads, we have this fibrous expansion that goes either side of the metacarpal head. And here, this is a primal pictures diagram. We can see the tendon forming these silvery looking sheets sitting over the knuckles and over the bases of the proximal phalanges. This is the dorsal digital expansion, and the function of the dorsal digital expansion is to protect the metacarpal heads when the fingers move into flexion. So as the digits move round into flexion and the metacarpal heads would normally be exposed, the dorsal digital expansion wraps itself around the metacarpal heads themselves. As the tendon passes distally, the central portion of the tendon goes off and attaches onto the posterior aspect of the intermediate phalanx here. The dorsal digital expansion, on the other hand, what it does is it carries on as two slips to attach onto the terminal phalanges of each of the digits. This anatomical arrangement is important because extension of the digits comes about by tensioning that dorsal digital expansion, a task which is left to these little muscles down here called the lumbricals. Next to extensor digitorum, we have extensor digiti minimi. There's extensor digiti minimi passing down here to the little finger. So starting off from the common extensor origin, going off and blending with the dorsal digital expansion of the fifth digit. Again, its nerve supplies the posterior interosseous nerve, C7 and C8. Now, extensor carpi radialis muscles, this time we have two of them. We have a longus and a brevis. The extensor carpi radialis longus is this muscle that we see up here, and it arises from the lower third of the lateral supracondylar ridge and the lateral intermuscular septum. It passes down under the extensor retinaculum before finally inserting into the base of the second metacarpal. Its action is to extend and radially deviate. Next to that, we have extensor carpi radialis brevis. Now, extensor carpi radialis brevis is the smaller of the two. Again, it comes from the common extensor origin, passes down under the extensor retinaculum before inserting onto the base of the third metacarpal. Again, this is comparable with the flexor carpi radialis that arises from the common flexor origin, goes off and inserts onto the palmar aspect, onto the anterior aspect of the bases of the second and third metacarpals. When these muscles work together, extensor carpi radialis longus and brevis and flexor carpi radialis, you get the movement of pure radial deviation. When the extensor carpi muscles work together, so in other words, extensor carpi radialis longus and brevis and extensor carpi ulnaris, we get the movement of extension. As mentioned earlier, brachioradialis and supinator are often grouped in with the extensors of the wrist and fingers because they share a common nerve supply and a common compartment. Both muscles were covered as muscles acting at the elbow and muscles acting at the radioulnar joints. Peel back the superficial extensors and we end up seeing the deep extensors. Now the deep extensors are made up of 4 muscles, the majority of which act at the thumb. We have abductor pollicis longus, which attaches up here to the posterior surface of the radius, ulnar and introsseous membrane. We've got extensor pollicis longus, which attaches here to the posterior aspect of the ulnar. Extensor pollicis brevis, which goes to the posterior aspect of the radius and adjacent to the introsseous membrane, and then down here we've got one that goes to the index finger called extensor indicis. So abductor pollicis longus is this muscle here, whose proximal attachment here is highlighted in green, arising from the posterior surface of the radius, ulnar and the intervening introsseous membrane, really in the middle third of the forearm itself. Forms a long tendon that passes over the dorsal aspect of the radial styloid process before going off and inserting into the base of the first metacarpal on the radial side. Its action is to produce abduction of the carpo-metacarpal joint of the thumb. Extensor pollicis longus, its proximal attachment is here in red. Yeah, so this is the middle half or the lower half of the posterior aspect of the shaft of the ulna and adjacent introsseous membrane. Its tendon comes down here, passes around the dorsal tubercle on the posterior aspect of the radius before going off and inserting into the dorsal aspect of the distal phalanx of the thumb. Its action is to produce extension of all of the joints that it crosses, so the interphalangeal joint of the thumb, the metacarpophalangeal joint and the wrist joint. Again, its nerve supply is from the branch of the radial nerve, the posterior interosseous nerve, C7 and C8. Extensor pollicis brevis lies next to it. This arises from the posterior aspect of the radius over here and adjacent to introsseous membrane, passes under the extensor retinaculum, sharing a common synovial sheath with abductor pollicis longus. Now this anatomical arrangement makes these two tendons prone to irritation, and friction between these two tendons can often lead to pain at the base of the thumb, a condition known as de Quervain's syndrome. The muscle itself, or the tendon itself, goes off and eventually inserts into the dorsal aspect of the proximal phalanx of the thumb, and again its action is to extend the metacarpophalangeal joint and the wrist joint. Extensor indicis is the final muscle in the deep posterior group. It arises from this lilac area here on the posterior aspect of the lower third of the ulna and adjacent introsseous membrane, passes under the extensor retinaculum before inserting into the extensor mechanism of the index finger. Its action is to produce extension of the metacarpophalangeal joint of the index finger, and it assists with extension of the wrist. This is the extensor retinaculum here. We can see this is the flexor aspect on this side here, with the flexor retinaculum going off and preventing bowstringing of all of the flexor tendons. But the extensor retinaculum is this structure. It goes across the back of the hand, goes from radius to ulnar, and it compartmentalizes pretty much all of the tendons of the extensors. So over here we can see on the most lateral side we've got the tendons of abductor pollicis longus and extensor pollicis brevis sharing a common synovial sheath. Over here we've got extensor carpi radialis longus and extensor carpi radialis brevis, again sharing a common compartment. Then we have extensor pollicis longus over here, followed by extensor indicis over there, extensor digitorum over here, extensor digiti minimi, and finally over on this side, on the ulnar side, on the posterior aspect of the ulna, passing between the head of the ulna and the styloid process, we have extensor carpi ulnaris. And as all of these tendons pass under the extensor retinaculum, they do so in synovial tendon sheaths. Irritation of these synovial tendon sheaths can lead to a condition known as tenosynovitis.